Everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about rehab burnout. What is it and what can we do to manage it and avoid it? Hey everyone, so today we're talking about burnout, and we're talking about burnout when it comes to your rehab, your recovery, your physical therapy after knee replacement surgery. And we're going to talk about kind of what it is and what causes it, and then I'll briefly give you some of my top tips and top pointers to help manage it, help either avoid it in the first place as best we can, but also know when that time comes where you do start to feel that burnout, what can you do, kind of what can you tell yourself, and what can you kind of reset your thoughts and your mindset to get back on the horse, so to speak, and continue with your rehab and recovery in a positive manner. So burnout is extremely prevalent. People considered, of course, that with replacement, knee replacement, and the rehab and the recovery, there's an extreme physical toll on your body. There's pain, there's stiffness, swelling, your decreased ability to do things. You're going to rehab multiple times per week. It's struggle and a lot of energy just to walk and to do your normal daily activities and take care of yourself or take care of your loved ones as well and helping them. So it can be really physically demanding. But on top of that, and probably even more importantly, it can be extremely demanding mentally and psychologically. There's a high prevalence of individuals who experience, at least at some point in their rehab, experience depression, anxiety, loneliness, fears of movement, fears of activity, fears of not getting better, isolation. I think I just said that one. All sorts of psychological and mental aspects and things that your body goes through. And having points where you're kind of in this valley, this low, where you just feel burnt out, you don't want to do anything, you don't want to do not even just your rehab and your physical therapy, but you don't even want to do your normal day-to-day activities or normal, maybe social gatherings or spending time with family or whatever it may be. You just may be so burnt out, you just want to lay on the couch or lay in bed and watch TV or, not do much of anything. And the first thing is you just want to tell yourself that this is normal, this is okay. You're not a failure, you're not a bad person, you're not trying hard enough. None of that is going on. It's a normal human response, a human aspect, just like any other stressful thing that you go through or a very significant thing that you go through in your life. There's going to be things that you have to manage. There's going to be obstacles. There's going to be ups and times where it's positive and you're making good progress with your recovery, but there's also times where there's going to be downs and there's going to be those valleys and obstacles, and that's normal and that's okay. We all want that straight path upward of recovery, but really, it's going to go up, it's going to go down, it's going to go sideways, it's going to plateau. Your recovery is not going to be this linear progression getting better and better each day, and that is perfectly normal and perfectly okay. So, I like to think of mantras, little phrases or sayings, and one that I like to share with people going through knee replacement or any type of recovery or surgery is, this is temporary, it will get better. This is temporary, it will get better. So if that's pain, if that's insomnia and difficulty sleeping, if that's stiffness and swelling, if that's trouble being able to have low energy and not being able to do things and feeling like you're up for things, depression, anxiety, this is temporary. Your body's healing, your body's recovering. If you are able to stay consistent and continue, keep moving forward one step at a time, you're going to get through this. It's going to change. You'll feel better. You're going to heal. You're going to recover for the vast majority of individuals who go through this surgery. Not everyone, unfortunately. There are people who don't have a positive outcome, who aren't satisfied, but that is the minority of people who have this surgery. The vast majority of people have positive outcomes. For some people, it takes a lot longer. It may take 6 months. It may take a year. It may take 2 years. Some people I've heard even longer than that. But if you're consistent and you stay the course, this is temporary. Things will start to get better. There's the phrase, of course, if you're going through hell, just keep going, right? Some other things I want to share with you is, like I've been saying this whole time, understand plateaus are normal. Setbacks are normal. You may go into therapy one day and your range of motion is one level, and then you go in the next day and it's 5 degrees less. Or you feel great one therapy session or one day, and then the next day you feel like crud. And that is perfectly normal and perfectly okay. Again, accept it. Accepting this is part of the journey. Focusing on what's within your control, accepting what's outside of your control. So, what I can focus on is the management strategies, managing my pain as best I can, if that's taking my medicine appropriately and as prescribed, if that's icing and using heat, if it's doing my exercises as prescribed and as recommended by my therapist, if that's getting up and walking and doing activities that bring me joy and make me happy, if that's reaching out to a friend for social support or a family member. All these things are within your control and things that you can do. You can't do anything about the weather. If it's snowing and cold and dreary outside, you can't do anything about, today I woke up with this pain. You can't do anything. You can't just, go back to sleep and hope that it goes away. You can do some stretches. You can do some exercises, do some things to try to alleviate it. You can make the most of it and just kind of plow ahead and get through with your day. Those are the things that are within your control. Try to focus on those things and then just have a peace and acceptance and serenity as best you can. Of course, this is easier said than done, of those things outside of your control. And then just take time to rejuvenate. You don't have to be on go 100% of the time. You don't have to do your exercises 5 times every day, all the time. Icing, heating, ice, heat, exercise, ice, heat, exercise, eat, sleep, ice, heat, exercise. Take some time to rejuvenate. It's not going to be the end of the world if you take a day where you do a little bit less. Or even if you take a day where you do nothing. Yes, I know this is coming from a therapist who we preach on consistency and doing your exercises and doing your activities and staying consistent. One day is not going to be the end of the world, though. One day to rejuvenate, to recover, to not focus on your knee and worry about your knee so much and just, do something else, do something with family, do something with friends, do something that makes you happy. That's okay. You want to rejuvenate both physically as well as mentally as well. It's the mental toll that usually leads to that burnout. So you want to worry as much about this, what's in here, your mental, your psychological, as you're worrying about that knee and your body physically as well. So this is just as important, I would say more important, for having a good outcome and a good recovery after knee replacement surgery. So don't neglect it. Take time for yourself, take time to rejuvenate, whatever that may be for you, and then slowly, surely take one step forward, get back on track. You can do it. Like I said, it's temporary. Things will get better. Stay positive. Control what's within your sphere and circle of control. Accept what's not. And you can do this. Thank you very much for watching, everyone. Be sure to subscribe. Check out all of our videos, everything related to knee replacement surgery, preparation, recovery, the surgery itself, frequently asked questions. Thank you very much. Take care.